Go.
I'm here with Dr. Francis in the Mal in West Heidelberg, and we're talking about the freeze that Mr. Turnbull and the Liberals have imposed on the amount that doctors get paid by the federal government. Dr. Francis and her colleagues here in West Heidelberg already bulk bill most of their patients, and we of course want to make sure that she can afford to continue that. That's why Labor will make sure that we lift the freeze on how much gets paid to doctors in our community, so that those patients who need to be bulk billed can in fact continue to get bulk billing. But Dr. Francis is going to talk about what she's done here in this clinic to make sure that she can continue to bulk bill while Mr. Turnbull puts the freeze on doctor fees.
So on a sort of a business level, we've had to tighten up our spending, and the particularly sad thing was we did have to reduce some of our staff hours. We've also had to try and implement all the different care plans and things like that too, which give us a little bit extra with bulk billing. And unfortunately for us, what we find is that's just paperwork. We already did the care on the patients. However, now we have to sort of spend a lot more time to make sure our paperwork is up to date so we can actually claim more item numbers.
And you've also had to extend your mortgage to make sure you can maintain the bulk billing that you have?
On a personal level, that's been quite hard because I love working here. I don't really want to leave. Most of our patients have actually got quite a sort of a low, well, they've grown up in a low socioeconomic area. We've got a lot of mentally ill patients and intellectually delayed. So to actually not bulk bill them, some of them would actually come in, some of them would pay all their money to see me, but I don't want to do that to them, obviously. And also the services, there just aren't enough. And so, I don't want to leave here, basically.
Well, we don't want you to either. We think it's very, very important that people in this area have got access to bulk billing. People don't have very much money, and we want to make sure they can afford to come to the doctor. We really appreciate the care that you give to your patients, and Labor will make sure that we reverse the cut that Mr. Turnbull has made to doctors so that bulk billing can continue. Thanks very much.
Thank you.